Hi, this is Dr. Naidu, and today I'm going to go through what to expect as you recover from breast augmentation surgery. Now, I'm going to qualify this by just reminding you that the process, what we recommend, is different for every surgeon. So essentially, you really want to follow your surgeon's recommendations, but I'll tell you what I do for my patients. So immediately after surgery, my patients will awaken in the operating room, and we transfer them to the recovery room for observation. We observe them for 1 to 2 hours before they are discharged home with a responsible adult. And some of the things that we want to see are that their blood pressure and heart rate are stable, that they're not experiencing severe pain, that patients are able to tolerate some food and water, and at that time we place a surgical bra for support. When you arrive home, you will notice that your breasts are going to already be starting to feel firm and tight. This is really normal. There is some swelling that's going to set in. What I recommend to my patients is that they get into bed and take a nap for 2 to 3 hours. The reason why I like to do this is that it'll allow the anesthetic to gradually come out of your system while you're sleeping, and this is also the peak period for postoperative nausea. So by the time you wake up, that peak should have passed and you should be feeling pretty good. At this point, I recommend that you eat something solid, take some pain medication if needed, and then get into a nice warm shower. Again, this will differ from surgeon to surgeon. I really like to let my patients get into a nice warm shower that evening because they can begin moving their arms around and over their head to stretch out their muscles. For most of us, we've put the implant underneath the pectoralis muscle on the chest, and that warm shower just helps to loosen everything up. Some surgeons will ask you not to shower for several days. The day after surgery, you'll notice that your breasts will feel tight and firm, and some of my patients will say that it almost feels as if something's sitting on their chest, and that's really from the muscle being stretched out. I ask my patients to continue the arms exercises that I've prescribed, and that they continue to wear their surgical bra for support. I do ask my patients to avoid any heavy lifting, exercise, or sexual activity for 2 weeks after surgery. During this period, if you have any high fevers, any increased swelling or bruising or increased pain, you should definitely notify your surgeon. 2 days after surgery, the breast should start to feel a little less tight as some of that swelling starts to subside. The implants may still be sitting a little bit higher than you expect. This is really normal, so just be patient. Continue gentle arm and chest exercises and wear your bra for support. Most patients will be able to return to work the following day. 1 week after surgery, I like to see my patients to assess for any unusual swelling or bruising. The swelling will be continuing to resolve at this stage. The breast implants will still probably be sitting a bit high, at least a bit higher than you expect, and that's, again, very normal. Really is from swelling and also from the muscles if they're particularly tight. I find that if patients do a lot of upper body work, then their muscles will be a bit stronger and the implants may sit higher for some time than if they don't. I do recommend that the surgical bra be continued for support during this period. 2 weeks after surgery, I let patients go back to exercise as tolerated, and I recommend that they start with gentle controlled motion and then work up to their normal level of activity. If you are a runner or if you do a lot of yoga or Pilates, you may need 3 weeks to get back to your normal level. Same thing for a lot of heavy upper body lifting. This is very regional. So in New York City, my patients tend to run or do yoga. If you're in Texas, you're probably a horseback rider. So in that case, your surgeon may recommend that you wait for 6 weeks before you get back on the horse. But please listen to your surgeon about this. At this point, you can generally resume taking off your preoperative medication, including any anti-inflammatory medication such as Advil or Aleve. Again, heavy lifting as tolerated is permitted. And at this point, I'll usually switch my patients over to a soft supportive bra. 6 weeks after surgery, almost all of your swelling should have resolved. The breast will soften a bit and the implants will begin to settle into place as your muscle continues to relax. The implants aren't going to fall per se, but they'll just settle a bit more. There should be no limitations on your activity at this point, and any garment use is permitted. 3 months after surgery, you'll notice your implants will continue to settle. There might be a little bit of asymmetry at this stage. That's pretty typical. Now keep in mind that if you start asymmetric, you will end a little bit asymmetric, and I guarantee you'll be looking at your breasts a lot more often after surgery than you did preoperatively. So just be patient with yourself, be patient with the healing process. We always mention that breasts are sisters and not twins. They're going to do their own thing at their own pace. So just be a little bit patient. You'll notice, though, that the implants will continue to soften. 6 months after surgery, the breast should be quite a bit softer as the implants have almost fully settled. Mammograms are okay at this stage, but make sure you tell your mammographer that you've had breast implants. They do have special techniques to move the implants around while they're squeezing the breast tissue. By 12 months after surgery, the implants have almost always fully settled, and I recommend at this point that you see your surgeon for an annual visit. Again, this is very practice dependent. My personal preference is to see my patients once a year just for a quick visit to make sure everything is okay, since this is a medical device that we've put in for elective reasons. However, we do recommend that you just follow your surgeon's recommendations in this. So if you'd like more information, please visit my website, naiduplasticsurgery.com. If you go to naiduplasticsurgery.com/guides, we do have some procedure guides which you're more than welcome to download for your own use. You can always give us a call at 212-452-1230 if you have any questions.